The most difficult thing about being a nurse is not about the poop, not about the understaffing, the smells, although GI bleeds are pretty bad. It's not about watching people die. There's something worse. Mary, are you okay?
I'm hungry.
I'm sorry, Mary. Everything is through the IV. Mary was admitted because her pacemaker was misfiring. She had declined from the last time I saw her. I knew Mary was aspirating. They did an x-ray and sure enough, everything she was swallowing went mostly into her lungs.
I'm so hungry. Please.
I can't give you anything right now. You'll start to choke.
Oh, please, I don't want to do this anymore. I just want to go home. Please.
I know. You keep saying that. I have Mary Davenport today.
I'm sorry, but it's your turn to deal with the daughter.
No, I mean, why is she still here? She was on comfort measures only and transferring. And now she's on aspiration precautions.
The daughter had the order changed.
Mary needs end-of-life care.
The daughter wants a peg tube placed. I just heard Dr. Reyna on the phone.
So now they're going to stick a feeding tube in her belly on top of everything else. Mary's advance directive specifically says she didn't want that. Why is the hospital allowing it?
Mary's daughter has the power of attorney. Fighting with Miss Davenport is more difficult than fighting with a dementia patient.
I can't watch that woman go through this and do nothing.
I would mind my business.
Advocating for my patients is my business.
I know Susan. She gets upset when she thinks a person is suffering. She's a big quality of life advocate. But sometimes the argument will fall on deaf ears. No one on the team is going to say anything because they don't want it to look like they're giving up.
I'm going to be completely honest with her. When she sees the whole picture, I'm sure she will reconsider.
I can see that look in your eye, sweetie. When something feels really good to say, it's usually the wrong thing. You know as well as I do, people see what they want, especially in a situation like this. Mess with that, and you're inviting a whole lot of trouble.
So what's our goal? Doing all this on an 86-year-old end-of-life patient?
It's what the daughter wants.
How's she doing?
We started her feeds.
I read online that her white cell counts are up to 11,000. That means she has an infection. Do you know what the doctors are doing about it?
I'm all for people being informed, but Miss Davenport reads an article online and thinks she's knowledgeable. I understand people being cautious, but it is difficult to work with someone who distrusts everything you do. Oh, and her cousin's a doctor.
You're right. White counts can rise slightly after surgery. Unless something new develops, it will slow back down.
Thanks. I'd still like to talk to the doctors about it.
Can you find Dr. Rana and tell her to talk to Miss Davenport in 140? Yes, now. And send one of the nurses in. Excuse me, are you taking pictures?
I don't understand. She usually does better. I would like a copy of all of her tests, please. My cousin is a doctor. He will know if anything was missed.
Miss Davenport, it takes older patients more time to recover. She's 86 years old.
What's that supposed to mean? You want to just let her die?
That's not what I meant.
She might just be another body to you. This is my mother. She's everything to me. I'm not losing her. She always recovers. She's strong.
I'm sorry, but the older we get, our bodies change. Her quality of life is gone. Maybe it's time to reevaluate. Maybe not put her through painful tests and procedures that won't make a difference anymore.
You're supposed to save people, not let them die.
Is everything all right?
Miss Davenport, I'm with her all day. I monitor her tests and her medication. I wash her, I change her diapers, I suction the gunk
She
out
will
of her
recover.
lungs.
She will be fine.
Can I
She's a
talk to you for a
fighter.
second?
You come here to visit an hour or two and then you leave. Please, if you stayed here, you would understand the state you're asking her to live in.
I want a different nurse. I want someone who is going to care for my mother. We are never coming back to this hospital again. I want her fired. Get out!
They say to me, seeing people die must be the most difficult part of your job. No, some things are worse.